So basically today we will talk about adrenal cortex. So आज हम बात करेंगे adrenal cortex के बारे में जो very very important organ है हमारे ऑर्गन जो किडनी है किडनी के ऊपर का जो अटैचमेंट है वो एड्रिनल ग्लैंड का है जिसके अंदर एड्रिनल मेडुला है एड्रिनल कॉर्टेक्स है। कल हम लोगों ने एड्रिनल मेडुला के बारे में डिस्कस किया था, आज हम बात करेंगे एड्रिनल कॉर्टेक्स। सो बेसिकली एड्रिनल कॉर्टेक्स, सो इट इज द पार्ट ऑफ adrenal gland and outer part of the adrenal gland. So what are the function, what are the secretions of adrenal cortex? It is very very important. So it will release steroid hormones. What will it will release? Steroid hormones. So what are those names? The names are mineral mineralocorticoids, mineralocorticoids, glucocorticoids, and the third one is and the uh, hormones for male and female hormones or sex hormones. So the sex hormones, female this estrogen, and male for androgens like testosterone. So, okay, so we will talk about all those things in detail. Okay, so basically what it will release in the blood. So basically it will release mineralocorticoids, glucocorticoids, and hormones of male and female sex hormones, estrogen and androgens. So androgen is similar to progesterone, not completely testosterone, not completely similar to the androgens. Okay, so they may contribute to rapid body growth during early puberty. They may also be important supplying estrogen to women after menopause and to men throughout life. Okay, so we'll talk about estrogen, androgens in detail. The function of the other adrenal cortex hormones are well known. However, these are considered vital hormones. So basically here the third hormone is very very important, that is aldosterone and cortisol. Okay, aldosterone is none other but mineralocorticoids. Okay, and cortisol is glucocorticoids. Okay, the other name or alternative name you can send or connection about the steroid which is connected to the mineralocorticoids is aldosterone. Okay, aldosterone, and will use it is a representative of this group of hormones. और यूं कहिए कि ये ग्रुप है उसके अंदर एक आपको एल्डोस्टेरोन एक हार्मोन है देखने को मिलता है जो ज्यादा हमारे बॉडी में यूटिलाइज होता है, इसका बहुत ज्यादा इंपॉर्टेंट है। द टारगेट ऑर्गन्स ऑफ एल्डोस्टेरोन आर किडनी, but they are very important secondary effects as well. Aldosterone increase the reabsorption of sodium and excretion of potassium by the kidney tubules. Sodium are returned to the blood and potassium are excreted in urine. Okay. So basically, what is the purpose of aldosterone? What, how, where it works? First thing, it is released by adrenal gland from the cortex. It is our, we have to remember first thing, where from where it is releasing. It is releasing from cortex of adrenal gland. So from releasing after what function, where it is the target organ. कौन से organ पे जाके ये काम करता है? What is the target organ? That is kidney. That is kidney. Okay. And what is the function after releasing of aldosterone hormone, aldosterone hormone into the blood and reaching to the kidney? What it will do after reaching the kidney? It have two things. What it will do? It will do two things. One is absorption of the sodium from the urine, whatever urine is formation, and excretion of potassium into the urine. And potassium is not absorbed, it is released into the urine. So these are the two things it will happen. Okay. So these are the things very, very important for us to maintain sodium levels. Sodiums are very, very important. Okay. Uh, for nerve or cell to cell functioning or cell function or nerve function, sodium and potassium both are important. Calcium also very, very important. Okay. So next, the number of factors stimulate the secretion of aldosterone. These are the deficiency of sodium, loss of blood, or a dehydration that lowers blood pressure, or an elevated blood level of potassium. So when did aldosterone is released? So what are the reasons to release aldosterone into the blood? So it may be the low sodium level or high potassium level. अगर ब्लड में यानी एल्डोस्टेरोन कब रिलीज होता है? रिलीज होता है जब ब्लड में पोटेशियम लेवल कम हो जाए। ओके। और सोडियम लेवल कम हो जाए और पोटेशियम लेवल बढ़ जाए और ब्लड के अंदर हमारा ब्लड प्रेशर कम हो। ओके। और ये सब चीजें देखने को मिलती है जब जाके आपको एल्डोस्टेरोन रिलीज होता है, ताकि यूरिन में ज्यादा सोडियम रिलीज ना हो और पोटेशियम ज्यादा बॉडी में ना हो। ठीक है। और इसके साथ साथ जब ये देखने को मिलता है, किडनी के पास अपना एक हार्मोन होता है जिसको हम कहते हैं रेनिन एंजियोटेंसिन हार्मोन। तो ये आगे आने वाला है। ठीक है। तो ये क्या करता है, इसके अंदर एक हार्मोन या केमिकल होता है जिसको कहते हैं एंजियोटेंसिन 2। एंजियोटेंसिन 2 होता है, यानी किडनी अपने अंदर एक हार्मोन रखता है ताकि वो कनेक्ट हो सके एड्रेनल ग्लैंड से। सो किडनी हैव वन हार्मोन, it will release one hormone. The name of the hormone is renin angiotensin. What will it will do when kidney absorb that the we have low amount of sodium, large amount of potassium, or low blood level, or low blood pressure, kidney absorb. So what will happen? It will release angiotensin. So what will angiotensin do? Renin angiotensin. It will release one chemical. That name of the chemical is angiotensin 2. What will it will do? It will stimulate the adrenal cortex to release aldosterone. ओके। एल्डोस्टेरोन को रिलीज करने के लिए मजबूर करता है कि भाई एड्रेनल कॉर्टेक्स क्या करे, एल्डोस्टेरोन को रिलीज करे। अब एल्डोस्टेरोन रिलीज होगा तो क्या होगा, सोडियम को ऑब्जर्व किया जाएगा और ब्लड का वॉल्यूम भी बढ़ेगा और ब्लड प्रेशर नॉर्मल में आएगा। ठीक है। तो ये फंक्शन है एल्डोस्टेरोन का अपने बॉडी में। Okay. So once again, I will revise, very, very important, because okay, what will it will do first? It will release from the adrenal cortex the aldosterone first. Second thing, uh, the target organ is kidney. Okay. And the function is to restore sodium and excrete potassium from the blood through the urine. Okay. So when it will release, whenever the low amount of sodium is seen, high amount of potassium is seen, or low blood pressure is seen, or low blood volume is seen. So if there is low blood volume or low blood pressure, okay, so what will a kidney do? Kidney need aldosterone. Okay, if directly aldosterone will release, okay, in some cases it will not release. So what will happen? So kidney will release renin angiotensin hormone. Renin angiotensin will release the chemical substance that is angiotensin 2. Angiotensin 2 will release, will connect to the, will give communication with the adrenal cortex that you have to release aldosterone. Please release aldosterone in the blood because there is a low amount of sodium. Potassium is in rich condition. Okay, blood volume is low. Low BP is there. So what will happen? It will release aldosterone. So this is the communication. Okay. So this is the mechanism of aldosterone, adrenal cortex, renin angiotensin 2, how they communicate with each other. Very, very important. Okay, next is cortisol. So it is connected to the glucocorticoids. Okay, cortisol increase the use of fats and excess amino acid, offer energy and decrease the use of glucose. This is called glucose sparing effect, and it is important because it converts glucose by for use by the brain. Cortisol is secreted in any type of physical stress situation, disease, physical injury, hemorrhage, fear or anger, exercise, and hunger. Although most body cells easily use fatty acids and excess amino acids, cell respiration, brain cells do not. So they must have glucose. By enabling other cells to use the alternate energy source, cortical ensure that whatever glucose is present will be available to the brain. So what is the effect of cortisol? Okay. So basically it is used. What is the function of cortisol? It have to be used to convert the whatever fat is stored, it is utilized to the body. What is the adipose tissue? What is the fast? Whatever fat tissue is stored in the body, okay, for utilization purpose, we have to release cortisol. Basically, we have fatty acids, amino acids, and glucose. Okay, in previous classes, we talked about fatty acids, the types of uh, fatty acids. Okay, so you can check the video for the details. Okay, so basically, only brain utilize glucose, but other body organs can use fatty acids also. Can it will use amino acids also? Okay, but cortisol will what it will convert other whatever fatty acids. Okay, whatever energy resources which are utilizing by the other parts of the body, it will decrease. Okay, it will remind that you have to use fatty acids, you have amino acids, you can use it. Please doesn't use glucose much more. Okay, because our brain need more glucose, so glucose is utilized by the brain. Okay, this is the main aim of cortisol. Okay, and other effects, what are the other effects? Other effects, it is have anti-inflammatory affection. During inflammation, histamine from damaged tissue makes capillaries more permeable, and the lysosome of damaged cells release their enzymes, which help break down damaged tissue, but may also cause destruction of nearby health tissue. Corticosteroids block the effect of histamine and stabilize lysosomal membranes, preventing excessive tissue destruction. Okay, so basically the other function. तो यहाँ पे हमने एक फंक्शन के बारे में पढ़ा था कॉर्टिसोल का, कि जो भी हमारे बॉडी में फैट है उस फैट को यूटिलाइज करना है। यूटिलाइज दूसरे ऑर्गन और ब्रेन में थोड़ा सा फर्क है। ब्रेन जो यूटिलाइज करता है वो ग्लूकोज के फॉर्म में यूटिलाइज करता है एनर्जी, उसको ग्लूकोज चाहिए एवरी टाइम। लेकिन दूसरे बॉडी का ऑर्गन अदर अमाइनो एसिड्स के जरिए से, फैटी एसिड के जरिए से भी कन्वर्ट करके उसको यूटिलाइज कर सकता है। ठीक है, तो अब कॉर्टिसोल का काम क्या है कि बॉडी के दूसरे ऑर्गन को समझाना है कि भाई आप फैटी एसिड से इस्तेमाल करिए, अमाइनो एसिड से इस्तेमाल करिए, ग्लूकोज का ज्यादा कंजप्शन मत करिए आप। तो ये क्या करेगा, दूसरे ऑर्गन्स को ग्लूकोज लेने में मदद करेगा कम करने के लिए, और ज्यादा ग्लूकोज को ब्रेन की तरफ भेजेगा वो, ताकि ब्रेन ज्यादा यूटिलाइज कर सके ग्लूकोज। तो ये मोस्ट इंपॉर्टेंट फंक्शन है कॉर्टिसोल का। ठीक है, अब दूसरा काम क्या है? दूसरा काम ये है, जब भी कोई सेल डैमेज होता है, सेल डैमेज होता है तो हिस्टामिन रिलीज होता है। whenever a cell damage occurs, what will happen, it will release histamine. हिस्टामिन रिलीज होता है डेड टिश्यू से। तो हिस्टामिन क्या करता है, अदर बाय रिलेशन वाले सेल्स को डैमेज करने की कोशिश करता है। सेल्स डैमेज हो तो टिश्यू डैमेज होगा, टिश्यू डैमेज होने की वजह से आपको उस नियर बाय जो भी ऑर्गन से या फिर ऑर्गन हो उसमें इन्फ्लेमेशन नजर आएगा, सूजन नजर आएगी। ठीक है, इन्फ्लेमेशन ये तो अच्छी चीज है ताकि रिपेयरिंग हो सके, डैमेज सेल्स जो भी है आपको रिपेयर कर सके। ठीक है, जैसा भी डैमेज होगा तो उसके ऊपर बैक्टीरिया आके अटैक करने की कोशिश करेगा। बैक्टीरिया के अटैक के प्रोटेक्शन के लिए हिस्टामिन। ओके, जब लेकिन ये एक अगर नॉर्मल रेंज में होगा तो सेल के लिए कुछ नुकसान नहीं है, अदर बाय नियर बाय सेल्स के लिए। लेकिन अगर ये ज्यादा मात्रा में इन्फ्लेमेशन पैदा करते, हिस्टामिन ज्यादा रिलीज हो, तो histamine will damage other by nearby tissues and it will make more inflammation. More inflammation means more cell damage. More cell damage means more tissue damage. More tissue damage means more organ will involve in this damage. Okay. So what will cortisol do? Cortisol will decrease the inflammation. It will try to uh, limit the inflammation. It will try to decrease the inflammation effect to other organs or other tissues. Okay, so it will also helpful in anti-inflammatory effect. What is called this condition is known as anti-inflammatory effect. Okay, the direct stimulus of cortical secretion is ACTH. Anterior pituitary gland, which is in turn is stimulated by corticotropin releasing hormone from the hypothalamus. This produces a physical stress condition mental illness. Although we often think of epinephrine is a hormone important in stress, cortisol is also important. The hormones of the adrenal causes suppress. So basically, another function of the cortisol is during stressful condition, it is also released. Okay, so these are the basic functions of cortisol. So we studied about aldosterone and cortisol. Okay, and other sex hormones we will talk in uh, female hormones. Okay, which we have in the ovaries, in the testes. Okay, in the ovaries we have different organs, different hormones, and in the testes we have different hormones which are secreted for multiple functions. Okay, so we talked about adrenal gland today. So in the adrenal gland, we have two portions. Okay, adrenal cortex and adrenal medulla. Adrenal medulla is inner, adrenal cortex outer membrane. Adrenal medulla will release two types of hormones, that is epinephrine and non-epinephrine. Epinephrine is very important for us for fighting and flighting condition, and also known as adrenaline. Adrenaline and epinephrine both are same. Epinephrine, non-epinephrine and non-adrenaline both are same. Okay, next we have outer, that is uh, adrenal cortex. Adrenal cortex have number of hormones. In that we have mineralocorticoids like aldosterone and glucocorticoids, that is cortisol, and sex hormones. Okay, these are the hormones which are very important. Aldosterone for kidneys for absorption of potassium and excretion of sodium. Okay, and cortisol for fat absorption and other responsible for the glucose absorption. Decrease the glucose absorption by the nearby organs or cells to send the large amount to the brain. Another function is anti-inflammatory effects. Okay, during a damage of the tissue, it will decrease the inflammation. Okay, and other sex hormones we will talk in ovaries and testes. One of the disorder in adrenal cortex will happen. That is Addison disease and Cushing syndrome. Okay, Addison disease is hyposecretion of the adrenal cortex hormones. Means it will decrease the secretion of the adrenal cortical. Adrenal corticals means we have cortisol, aldosterone, both. Okay, but there is the unknown reason why this is happening. Okay, what will happen? It will both are decrease. What will happen? It will not absorb the sodium. It will release the potassium more from the blood and absorb the sodium potassium and release more sodium. What will happen? You have low sodium levels, high potassium levels, which is very dangerous, and it will allow the death to the person. And other is cortisol is decreased. What will happen? Fat absorption decrease, less amount of glucose will release to the brain. So the patient is very uh, nearby death. Okay, in addition disease. And in Cushing syndrome, what will happen? Hypersecretion of adrenal cortex. So what is opposite to the Addison disease, Cushing syndrome? What will happen? Large amount of sodium is absorbed. Okay, what will happen? Sodium is high in the blood, and potassium is low. A large amount of potassium is retained into the urine. What will happen? So potassium is low. Okay, and other is anti-inflammatory effect. Okay, and we utilize large amount of energy. Okay, so large amount of energy we utilize large amount of energy we have. Okay, you have always higher respiratory, higher functions. Okay, so these are the things we can see in the and other conditions also be seen like arthritis, rheumatoid arthritis seen, or severe asthma also seen in corticosteroids. Okay, so these are the things we'll see in Cushing syndromes. Okay, syndrome is multiple condition. Okay, in which we have a lot of other related disease also seen. Okay, so I think today we'll stop here only. I think you understood about uh, adrenal gland. Okay, tomorrow we'll discuss about ovaries and testes. Next, we completed the endocrine system. Then after we will start blood. Very important. Very important class. Okay, we will start after the endocrine glands. So any doubt you can ask.